Hey guys, what's up? So I just want to do a little update video. I am having surgery on Thursday, so I just kind of wanted to talk about that a little bit. It is not a trans-related surgery. It's like the first time it's not a trans-related surgery in who knows how long, but it is a knee surgery. I met with my new surgeon on Monday, and you know what? I think it was kind of a blessing in disguise that I had this surgeon switch, because it was like this difference in opinion, and I think it's all gonna work out for the best in the end because of the treatment option difference and his opinion difference. And I feel like overall he spent more time with me and really looked more into my chart, my file, and my MRI and all those things. So long story short, I was originally going to see a different surgeon, and I was going to have something called a tibial, or a high tibial osteotomy, and that's because I have arthritis in my knee, and it was going to be basically my only option until I have a knee replacement surgery. But that doctor was active military, so he ended up leaving, and I got assigned a new doctor. I saw this new doctor. Upon first meeting with me, he was talking a little bit more about suggesting partial knee replacement because it will last longer and that sort of thing. I mean, there's always the pros and cons to each procedure, but the procedure that the other doctor was going to do, he didn't agree with for a copious amount of reasons, and also it was the technique that he was going to perform of his surgery he didn't agree with at all, and said that it just wasn't going to work. So I was very thankful for his opinion. I think it's like this accidental opinion really brought to light that this all happened for a reason, and God was watching out for me, I guess. So upon looking more at my knee, he examined my knee a little bit and saw where the pain was. Then he looked at my MRI, and he was just like, "You have a really bad meniscus tear." And apparently, you know, the radiologist reported that I did not have a meniscus tear, but he didn't agree with that at all. He's just like, "I'm a doctor and I can see very clearly that you have a really bad meniscus tear." He's like, "I can see where your old surgeries were and your old tear, but I can also see a new tear, like, that you have here, it's torn." And so it's just like, cool, like that's what I thought I had, and then it ended up being arthritis and all these other things, which I still have, so that sucks. But new treatment plan, I'm having a scope put in my knee. He's going to go in there, clean it out, and then he said for the parts of my knee where the cartilage is gone, he can drill into my bone, and then it will kind of encourage this other type of fibrous tissue. I'm not a doctor, I don't know the terms exactly, but it's to encourage some other sort of tissue growth that might also help prolong my need for knee replacement surgery. So basically after this surgery, he said I could have a few more years maybe if I wear this other brace that he ordered for me to wear after surgery. It should provide me a little bit of symptom relief, and then maybe instead of having knee replacement surgery now, it could be maybe like 2 to 3 years from now. And I'll take all the time I can get before I put different pieces of metal and plastic into my knee. So also the recovery time will be much less than like just going straight for the partial knee replacement. So I'm not really into long recovery times. I've had enough of those for this year. So yeah, I'm kind of just stoked that it's gonna be a lot more minimally invasive than it was gonna be. So that is that. Thursday is my big day. Go in at 9:15 and then recover and get back to life. My last video I made about my arm and how it's still really stiff and how really tight, and how I just hate the feeling of that, and it gets swollen sometimes. And someone mentioned in the comments that I should look into something called a scar revision or a scar release. And that really caught my eye, because I think I've heard a little bit about that, and even my physical therapist mentioned that I should look into scar revision. And I didn't really think it was an option for me, but I emailed my primary care physician and asked her if there was like a plastic surgeon in the area she could refer me to, if this was even a thing. and she didn't hesitate to refer me to a plastic surgeon in the area, and she said, I really hope that they can help you out. And so now I've got that referral going through. I'm just kind of waiting to get an appointment in with a plastic surgeon nearby, so maybe they can help me out with some of the tightness. I'm not really sure, but I will definitely keep you guys posted on that. I don't know what they're gonna do, if anything, but it's worth a try, worth a shot, because it's just really tight up in here. A lot of the swelling kind of accumulates right in this. Like, I have some rolls. It's not too swollen today, so it feels pretty good actually today. But yeah, just this whole chronic wrist pain thing is kind of a pain in the ass. Like, rotating my wrist is pretty painful, especially in this direction. So I'm kind of like, wow, I never knew that I was giving myself a chronic wrist injury for the rest of my life. I don't know, it might go away more with time as things loosen up more, hopefully. But I would like less wrist pain, that'd be nice. And yeah, then there's like this part of my arm. If I like, I'm not trying to flex, but you can see how tight it is because I go like this and it like creates like this roll right in here because it just doesn't move. It, like I said, it feels like I have a splint on, and that's about it. I'm gonna stop talking now. So, alright, Thursday, wish me luck. Thank you so much for listening to me ramble about random things and all your support. I really appreciate it, and I don't know what I'd do without you guys, so I'm just really thankful. So thank you, and peace out. I will see you next time.